Hello, I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is unwanted fat under the chin, the neck area. So why do we get this fat? Well, sometimes it's genetic, we're just born with it. Sometimes it's after dieting, sometimes it's as we've gained weight. So there's several ways to get rid of that fat. Let's talk about the simplest. One, we can dissolve it with injections. The ingredients is Kybella. This is an enzyme that comes from our gallbladder that we naturally make when we have a fatty meal. The scientists have isolated this, put this in syringes, and we draw out a map under your neck. Then we inject it. We wait several weeks and we do another layer. We wait several weeks and do another layer. And then we wait another several weeks and do another layer. So what happens is it gets into the skin and takes off a layer of fat, then takes off another layer of fat, and takes off another layer of fat. We can only do it around the neck area because if it gets into the nerves up in this area, it could permanently damage them. Why don't we do it all at once? For the same reason, we don't want to damage any of the underlying structures. Now, it doesn't help with the skin, so it's really indicated with the younger patient who has good skin turgor. So what's another way? Liposuction. We often do this in the office. We numb up this area with what we call tumescence fluid. It has numbing medicine and anti-bleeding medicine. We make a small incision behind the ear and in the chin area, and then we liposuction. The cannula is about the size of a pencil. It goes back and forth and mechanically removes that. We then put a strap on your neck that you would wear for about the next 2 to 3 days and then all evenings. And why is that? Well, if this is the skin, this is your muscle, nerves, arteries, and veins, we go in and put the cannula in and suck out the fat without injuring the nerves, arteries, and veins. Then we go ahead and put the strap on, and the distance between my finger and my knuckles is the contour restoration. Okay, but what if you have a little loose skin? Because now you may have fat there, but the skin may be loose. Well, then we add, after the liposuction, radiofrequency. This is called thermy. It's a little probe that goes in the incisions after we've done the liposuction, and it heats up the skin from the undersurface. It has a thermometer on the end, and we measure the heat of your skin, and we bring it right to the maximum amount of benefit for shrinking the skin without injuring the skin. Sort of like shrink wrapping your neck. What's the last way? The last way is when we combine it with a facelift and we do direct excision. Because if you have too much lax skin, usually in the middle-aged or older patient, we have to remove the skin. So what we do is when we make the facelift incision, we go in, we remove this under direct vision, and we can go in actually under the muscle and take out fat if there's under the muscle fat, which we can't do with any of the other techniques, and then tighten the neck. Please look at our neck blogs or our facelift blogs and videos on this topic. So in conclusion, depending on your age, your skin quality, your recovery that you would like to have, and your underlying fat placement, we have various options fulfilling our goal. One goal, many options. If you have any other questions, please come and visit us. Thank you.